Good afternoon everyone. My name is Dr. M.T. Khan, orthopedic and knee consultant attached to Criticare and Safety Hospitals. Today I am going to discuss the use of peroneus ligament for ACL reconstructions. So, ACL reconstructions are usually done with the help of multiple tendons from the body. Either people take semi-T or gracilis ligaments, which are your hamstrings. There are people who take bone patellar bone tendon, and there are people who use quadriceps tendon to reconstruct your ACL ligament. But my choice is peroneus ligament, and the reasons I am going to enumerate now. First is the ease of harvest. On an average, I am able to harvest the peroneus ligament completely in a matter of 3 to 4 minutes. And second advantage is the size. I have never had an issue where the peroneus ligament size was less than 24. So the minimum length that I have got with the peroneus tendon was 24 in size, in length. And when I triplicate this ligament, the diameter, I have never got it less than 8 mm in thickness, and my usual diameter is around 8.5 and sometimes even 9, depending on the height of the individual, strength of the tendon in that particular patient. So the advantage is that I am able to get a diameter of my choice, that is 8 plus 8.5 plus mm, and the length of the tendon is usually, when you stretch it, it is almost around 24 to 30 mm in length, and when you triplicate it, the average diameter is 8.5 and the average length is 8.5 centimeters. So by doing this, I am able to get at least 20 mm of the tendon into the femoral socket, 30 mm into the infraarticular portion, and another 30-35 mm I am able to get into the tibial tunnel. By this way, the fixation of the tendon in the tibial tunnel is very secure, because with the help of an interference screw, you are not worried about the length of the tendon into the canal. So that becomes a very secure fixation. In many of our individuals, especially the females, the hamstrings are so thin that even after quadruple, you get a diameter of 7.5, which is never the case in case of peroneus. So peroneus is my go-to tendon for an ACL reconstruction. And another reason that I like to use peroneus is basically in cases of ACL reconstructions with hamstring tendons. What I have seen, it is my personal observation, that after 6 months, you still have that grade 1 laxity, because the ligaments, the tendon of the hamstring, they stretch over a period of time. But this particular complication I have not seen as yet with peroneus tendon. You get the same tension, the latchment is always negative. So that is another advantage of using a peroneus tendon. And also people ask me what happens to the function of the ankle. As of yet, I have been using peroneus tendon since last 6 years. I would say from 2018 onwards, I am using peroneus tendon as a primary tendon for ACL reconstruction, and I have not had a patient who has come to me saying that he is disabled with an ankle pain. People have gone back to sports, people have gone back to cricket, people have gone back to kabaddi, and people have gone back to soccer. Yes, I still have to do a long-term study, but then usual when you ask a patient whether are you able to go back to sports, are you able to walk on your toes, are you able to walk on your heels, are you able to squat and get up from a sitting position, the basic questionnaire that we ask, no patient has given me any problem that because of the harvest of the peroneus tendon. So the harvest is good, the length of tendon is good, so even if I triplicate, I still get a diameter of around 8.5, and the length of the graft is usually around 85 mm. So because of these advantages, I have shifted myself to completely a peroneus surgeon. And last thing that I would like to emphasize that, see, ACL is an injury of the knee joint. If you are taking another ligament from the vicinity of the knee joint, you are further jeopardizing the strength of the knee. As such, what happens in ACL, when you have a ACL injury, the tibia moves forwards. When you are taking hamstring tendon which come and attach to the tibia and pull it back, if you remove that, I believe that the translation will increase. I have not done a study as yet, but these are my certain observations, and I've been very happy with the use of peroneus. And what we have seen that in last 5-6 years, more and more surgeons across India and the globe are coming up with uses of peroneus. Initially, peroneus was only used when there was no hamstring tendon, or the hamstring tendons were very thin. That was the time people used to use peroneus, but I have started to use them as my primary ligament. Thank you.